United States, the United States of healthcare. And Joyce Griggs, who is from the pharma industry, her experience is extensive with various pharmaceutical companies that she can talk about. But she decided to become a health advocate blogger and also a subject matter expert in helping all of us learn a little bit more, if not a lot more, about how to talk to our healthcare professionals, as well as how to be advocates for ourselves. And so we're excited about that. And then France Jacot, who I mentioned before, also has a background in, she has a background in healthcare, but also consumer product marketing. She has 20 years of experience with companies like Kellogg's and Coca-Cola and Advil and Capital One, what's in your wallet? And so she has really done a great job, not only living her purpose through her work, but I want to talk a little bit about her healthcare background and fitness background. We met through Conscious Capitalism, France. And when I knew you, you were part of KidCraft, and you've now gone into an area that I love is trampolines. I've always not been like a great trampoline, whatever master on the trampoline, but I love to jump on a trampoline. But you work with Springfree Trampoline, is that correct?
Yes, Springfree Trampoline. We're the world's safest trampoline.
That is so cool, because that was the one thing that our parents didn't like, right? Is I'll let you jump on it, but you better be careful.
Yes. No, our company has a lot of intellectual property. We've removed the springs, and we have fiberglass rods that are angled between the mat and the frame to provide a very safe trampoline that has no hard areas that you could jump or fall on. And so it's quite a great product to work on, because it's great to be able to offer consumers something that gets them outside, gets them active, but at the same time, as a parent, you feel peace of mind.
And with the pandemic, I'm sure trampoline sales, people staying at home and wanting the kids to stay home, have skyrocketed.
Yes, we've seen a massive increase, as many outdoor recreation categories have. We've more than doubled our sales since the pandemic. And our biggest challenge right now is getting as many trampolines into backyards by making sure we have inventory. So we have a lot of customers who are interested in our product. So it's been good for the business, but I do believe good for, getting trampolines that are safe in people's backyards.
All over the world, are people jumping on trampolines?
Yes, people are jumping on trampolines all over the world. Our business tends to be North America, Australia, New Zealand, and Europe. And that's the markets in the world where we see trampoline penetration at its highest.
And I noticed your pink glasses, and
yes,
you also are selling a pink trampoline as part of Breast Cancer Awareness Month. I love this.
Yes. So our company is the only vertically integrated manufacturing trampoline company. So we have the ability to do almost anything with the trampoline, and we have, customized trampolines available. And the company at Springfree, it's really one of the things I loved about it is it has very similar values to what I have. And that was the kind of company I was looking for. And so we give back to a number of different organizations. Mental health, children, and cancer this year have been our areas of focus. And so October 1st, we launched a pink trampoline, and it coincided with Breast Cancer Awareness Month. And we had just a limited amount available. And we thought, oh, this is great. It'll allow us to get the word out. There was, we made some financial donations to Susan G. Komen, and our trampoline sold out by October 12th.
Wow.
We've been very happy for that. Yeah, it is really wonderful. We kind of have a notify me list now, just because we can't get more trampolines, in October. We just don't have enough time. But next year, I can tell you, we will be doing this again, and we will know to offer more limited edition trampolines. So it's really, really exciting. And then we've also got some employee participation that they'll be walking in the walk that's happening in Dallas on October 23rd. And that's, of course, to raise money for breast cancer as well.
And of course, that's happening all over the country, as well as the world. I actually took part in a walk, Susan G. Komen walk in Rome several years ago, which was phenomenal, walking around the city of Rome when they closed down the streets. And so I don't know, Joyce, whether you're seeing anything in Greece. You're in Greece right now.
Mm-hmm.
I'm not reminding you that you're in Greece. I'm just letting the audience know. And we talked about this earlier with Franz, that she's from Nova Scotia. We got a little jealous about that. She's from Canada. I want to come back to you, Franz, about your time in Canada and the comparison between healthcare here in the United States and Canada. But Joyce, are you seeing in Greece any, I don't know, signs of pink ribbons and breast cancer awareness? Just curious.
Yeah, I haven't seen a lot of pink ribbons, but Susan G. Komen, the Walk for the Cure, is definitely happening here. There are posters around, and so yes, it is a worldwide phenomenon. But I haven't seen any pink ribbons yet. But I'm on the lookout.
Oh, good. Oh, good. So tell us, Joyce, your experience in the pharmaceutical industry has led you to patient advocacy or just self-advocacy in this area, not just breast cancer awareness, but for everything. How did you get interested in this, and what motivates you to inform us all?
Well, I started United States of Healthcare. Like many of us, you find yourself in a health crisis situation. And of course, because I have over 20 years of experience working in healthcare marketing, I was a very educated consumer, and my former husband had a health crisis. And as we kind of walk through that journey along the way, and I advocated for him, there were a number of things that happened that I remembered saying out loud more than once. How does anybody live navigating the U.S. healthcare system? There were so many times where we could have taken a big misstep, but we were able, not to do that. Thank goodness. And so it made me realize that, even when you know a lot about the United States healthcare system, how it works, what to do, who to ask, how to ask for it, you can still find yourself, backed into situations that make you scratch your head. So I began to use my own experience plus the experiences of experts that I know working in patient education, patient advocacy, and also just in healthcare overall, beginning to interview folks, tell their stories of navigating the US healthcare system, and not only bringing that empathetic moment, but also ribboning these posts with pro tips, to take folks through, like, what are some of the things that you can do to improve your own health? Because there's data that show that just patients, or I'm going to say people, but when we ask questions of our healthcare providers, you ask questions, data show that if you're asking questions, you're going to get better healthcare. because
Wow.
you're in an engaged situation with your health provider. So yeah, so that's kind of what led me to start the blog and a movement, I hope, for a nation of health self-advocates, beginning to change that dynamic between ourselves and our healthcare providers.
Franz, how does Canada differ from the United States in terms of healthcare, just like on a general level?
Yeah, I think the Canadian system, there's fewer people in Canada, there's fewer resources, there's fewer providers. And because of that, and then I should add that it's more of a socialist system. So because of that, people queue. And so when someone is needing something, they are sometimes told it'll be a 3 or 4 month wait. And the Canadians, of course, which I am one, and so, we just wait. And I can, certainly speak to, as Joyce said, when there's a crisis, that can be rather difficult. And the one thing I didn't mention is that I myself was diagnosed with breast cancer earlier this year. And so through my journey in the US, and I found out that, I had a mutation. And so all my family back in Canada is also getting tested. Well, I had my results and testing done in 3 weeks. They are waiting a year to a year and a half.
Wow.
Their testing complete, including my mother, who's 85 years old, to get tested fairly quickly. So I would say that is the big difference that I see, having experienced both systems.
That's a big difference. And
yeah,
I mean, I
and
think
Joyce, I'd be interested. I mean, is that what your experience would be, one of the major differences? Or I don't know if you've had much, work with the Canadian healthcare system.
Yeah, I mean, I can't say that I know a lot about the Canadian system. I did interview a professor who was Canadian, who was diagnosed with tongue cancer, and he actually came to the US for treatment because he couldn't get the treatment. It was very late stage cancer. He could not get, it was a surgery was indicated treatment in that case, and he couldn't get it in Canada. So he used his resources and came to the US and had his treatment here. So I mean, there's a double edge, I guess, in the system in that way.
Yeah, and that is quite typical for Canadians to travel to the US or other countries if they have financial means, if they want to move faster through the system.
Yeah.
Wow, that tells a story, doesn't it? It's we're so happy that you're healthy, Franz, and look so beautiful. And I think you've gotten good health care, obviously.
I've gotten great health care. Look, I'm really, really grateful. No one wants to be diagnosed with any type of cancer or breast cancer. It wasn't something I was expecting. But what I can say is, in the US system, I've had great care, and I have a good medical team. I'm still going through my process. Cancer is gone. So that's news right now. I'm super happy about that.
Yeah.
And
we're super happy for you.
I know. I'm really grateful. Look, it's and what I can tell people is, make sure you're doing your regular monitoring, whether you're a male or a female. There's a number of different, things we can be doing on a regular basis. And, ladies out there, get your mammograms. This was just found by an abnormality on a regular old mammogram. Like, I was just in and getting it done. And then, of course, as I progressed through each test, and I was diagnosed with breast cancer, I was really happy that it was caught quite early and I could get it. So, if I can really encourage people, not just mammograms, but whatever it is that you need to do on a regular basis, get out there, because early detection does save lives.
Fantastic. And this
That's it.
platform, Cinderella CEO, is a learning platform for women and men, but it really makes a difference to hear your stories so that people can understand, hey, it could happen to anybody, but it's also, we're a support system in that you may be at the grocery store, you may be at the office, there's somebody probably next to you or on Zoom who has experienced something that's very similar. I didn't know, Franz, when I contacted you about what you were up to and how, what your health care had been like and things like that with experiencing breast cancer. But I've always just been a big admirer of yours because one, as I mentioned, we met through conscious capitalism, but your purpose-driven work in marketing, I felt was always so inspirational, and it's in alignment with how, that's why I really wanted to bring you and Joyce together, because I feel and see you both doing things that are not only benefiting the companies you work for, but you take a deep you've made a deep commitment in helping other people keep their health and fitness in the forefront. And so, Joyce, when you see and hear from somebody like Franz, and you or I know you're a big yoga person and you love yoga and you do your yoga in Greece, is there something are there any other healthcare brands out there or products you're seeing that are doing a good job in helping or marketing to women? I know you mentioned an app, I think, for women to help them. Let's see if I can find it. It's called Let's see, am I missing that name? Mediflex or?
So, oh, right. Okay, so there is a there's a platform called Mediflix, which is a streaming service, free streaming service with healthcare information that's kind of brought to you. It's put by experts, right? So leading experts in disease states have met leading experts from entertainment, and they've come together sort of like peanut butter and chocolate to create the Reese's peanut butter cup of healthcare edutainment. So yeah, Netflix is a great place to go for health information.
And it's mediflix.com.
Right, that's right.
And your website is United States Healthcare.com.
My website is www.unitedstatesofhealthcare.com. So just healthcare replaces America. UnitedStatesOfHealthcare.com. Yeah, that's our website. So, and we have a blog that people can subscribe to if they'd like to. Yeah, absolutely.
So those are great. And again, I love your blogs. They're fantastic. The question I just wanted to put out there too was, is there anybody else that you all think is doing something spectacular, like Springfree Trampoline, that's making a fun contribution to breast cancer awareness or anything else for women? Just curious.
Oh, there's a number of brands that are connected with breast cancer, and this is just a few that I've seen, but I believe that Olay is doing something with breast cancer this month.
Oil of Olay?
Yes, I believe so, and maybe Dove as well, which I think has always been on the cutting edge of communicating to women on their own terms. So really talking about what does real beauty look like. And so I think as women, we we want to be able to judge ourselves for our own strength and what we believe makes us strong and powerful versus the communication of, let's say, the 70s and the 80s. And I mean, I worked on Special K, you know, even in the early 90s, and used to have a positioning around, you know, looking good. And it was all about looking good. And then in the early 90s, the consumer insight we had was looking good on your own terms. And that was a massive insight that changed how we communicated to women and really saw that brand grow for the first time in a long time. And so I think there's a number of brands where that connection to breast cancer fits really, really well. That might be a couple of examples that are out there this year. And certainly not if this year I've seen them in the past.
Great.
That organization.
Fantastic brands.
Yeah.
Joyce, is there anybody else or anything else that might be helpful to us in terms of understanding healthcare in the United States and being advocates?
I think, you know, from my perspective, the things that I've been focusing on in terms of my conversations, the content that I've been putting forward in the channels that I'm involved in are really about this notion of increasing our everyday, you know, knowledge of our own healthcare. So what, you know, in the parlance of the, you know, of the experts, it's health literacy. What's your health literacy, right? So we talk about financial literacy and increasing our financial literacy, particularly as women, and also health literacy, because when we understand more about our own health, whether it's just the routine care that we're getting, what are the blood tests that we get every year, what is it that the healthcare professionals are tracking, et cetera. So when we have a knowledge base, we come to the conversations with our healthcare providers in a partnership situation, right? You don't sit down with your accountant and not ask any questions. You know, we ask a lot of questions. We tend not to, there tends to be a bias, you know, sort of ingrained bias in us about not asking questions of healthcare providers. Healthcare providers actually need to hear from us. They'll tell you, in order to understand what's happening with you, they need to hear from the patient. They actually need to have that dialogue. That's a large percentage of what goes into putting care plans together. The thing about healthcare in the US is that even with the best clinician, the visit is time bound, right? Insurance companies have kind of come into our world, and there have been certain constraints, right, that's put on the relationship. So there is only a certain amount of time available in the appointment. So we have to sort of think about what can we do when we come to the appointment to do our part. So one of the things that we recommend that we do before we go into an appointment is write down our questions that we might have, or things that are on our minds, how we've been feeling. Even the smallest thing could be meaningful to the clinician, and then hand it to them when you walk into the room. I've mentioned this to clinicians. What if I just hand it? What if your patients were handing you a piece of paper? Oh my God, that would be fantastic, they say, because then they can decide what's important and what's not important, as not that they're trying to, you know, tell us what's important to us, but rather from the clinician perspective, right? There's a prioritization that can happen. So there are things that we can do in changing the nature of that relationship and kind of creating our own confidence in understanding a little bit more about what's going on, or at least what we should ask. Even if you don't know what to ask, you always ask, what other options do I have? If they're putting something forward to you, the number one question to always ask is, what other options are there available to me? Are these the only options? Because the healthcare provider is going to tell you what they think is best, but that may not be what you want to do in the end. There may be other options, and you want to hear what they are.
Fantastic. What would you add, Franz?
I was just going to say, I would love to add a little thoughts on that, Joyce, because I've just lived through that. So
yes, love to hear it.
Everything you said just really resonated with me. And I'm going to say I've had the privilege now of probably helping 6 people who are going through breast cancer, and they get diagnosed and they get put in touch with me, which is, I'm so happy to sort of pay it forward. And there are probably 4 things that I tell them, and they really do match what you said. But the first is about being your own advocate. And, it's also, sometimes you'll be told, oh, here's the doctor you'll want to use, but it may or may not be the doctor you want to use. And I think the very first thing you have to do is take a deep breath, and you have to say, okay, what am I looking for as a journey? And we're humans at the end of the day, and we have backgrounds, and we have personalities, and we have values. And so you really want to go and just make sure you've talked to a few different people. And then, like you said, Joyce, you're going to want to understand, what are my options? And then, don't just do a Google search. Go talk to other people who have been through it, like people are now doing with me. So I'd say that's number one. Completely aligned with the financial implications comment, especially in the US. And, I can compare to Canada, where you don't really pay for things. In the US, you really need to understand, what's in network, what's out of network. Sometimes there are additional costs for certain procedures because they may bring in an extra staff person. These are all the questions you want to ask. And you're 100% right when you say it's just like talking to a financial advisor. And then the third thing I would say is just be a document expert. Document everything that's going on. Write down your questions, as you said, but also make sure if you're getting scans and procedures and results, put them in a file. I have a briefcase that's 3 inches thick with all of my paperwork, which I just carry around. And I think every time they ask me a question, I go, yep, I've got that. Just a second. Out, and I almost don't have to think about it. So that's another thing. Just write it all down, because you're going through a lot. And so you are going to forget things. And then the last thing I would say is just be thankful and gracious with these people. They're caring for you. And I think just saying to someone, gosh, I appreciate you, or thank you for what you're doing for me and my family, that goes a long way for people. And it does help build that connection and relationship, because after all, we're equal team members in this journey. They're trying to help you and you're trying to get better. And so there's that mutual respect. Yeah. And so I would say those for me were the things that I learned along the way. And I wish I would have known them before I had to kind of go through something. It was certainly an accelerator that made me very buttoned up. And I think as I think about my children, or if I had to take care of my spouse, like, I'm organized, I'm ready. I've got this process set up. And so I think from that regard, it is nice to sort of have sort of a strategy and a plan, and to be able, like I say, to help others. And, that's really what it's about. Because when you first go through a crisis, you're in a bit of a fog, aren't you?
Yeah. Oh, absolutely. I mean, I think it's really twofold, when a health crisis arises. Is number one, how am I going to live with this? And then number two, how am I going to get the care? Like, literally, how am I going to get from A to B to C? How am I going to get that care that I'm going to need? And I think that self-advocacy is important. And then also bringing an outside advocate into the picture, I think, can be super helpful also. And it could be a paid person, but it could also be a family member or a friend.
Yes, good point.
I had one friend say to me, who was a cancer survivor, she said, I had that friend who was that really detail-oriented friend, and I needed some research to be done. And so people wanted to help me. So I put that friend on that research. And so bring the note taker with you to the appointment, to take notes for you. There are many ways to bring advocacy and help into the equation, especially if what, we're dealing with is super serious, because we're not going to remember. We're not going to remember what's said to us, and we could be engaged and asking questions and all in. We're going to remember very little of actually what is said to us in the details. And when we go to then, say, oh, what did the doctor say?
Yeah.
Oh,
Yeah.
yes, let me tell you what the doctor said. And then, right. And then we start, and then we're like, the details begin to become elusive. So it's really, the note taking, I think, is so critical. There's also an app. I thought you were going to ask me about this, Cary. Before, when you were mentioning Metaflix, thinking about it, it's called A Bridge. And it's an app that you can use. It's a free app to record your conversations with your doctor. And I recommend it. It's really kind of great. Now you have to ask doctor, any healthcare provider, you have to ask them if they're okay with the recording. Some are, some aren't. Most say yes, but it transcribes it automatically.
Wow.
And then it highlights all the medical terms that it finds.
Oh my gosh.
And then you can then click on that, and it takes you right to a definition of that term. So it's a really fabulous little app for the documentation.
And it's A Bridge, so AERIDGE.
Yes.
Okay, cool. Wow.
I've written that down too. I hadn't heard that one, and I'm going to check that out.
Yeah, it's really cool. You can do like a little test with it, and throw in some medical terms, and you're like, oh my God, look at that. That's so cool. It's a very cool little thing.
Well, I love that. And you also, Joyce, I think before we wrap up, I want everybody to give us some final thoughts, but you also have something that people can download off your site. Is that correct?
Yeah, and I wanted to, thanks for reminding me about that, because, France, you mentioned like picking a doctor, and, the doctor that you thought was fantastic may not be the right doctor for me, for whatever the reasons are. We're individuals. And so on our site, if you go to our website, unitedstatesofhealthcare.com, in resources, there's a PDF that you can download that will take you through the steps of what does it take to find a new doctor or healthcare professional. And we take you through, we recommend interviewing doctors, just like we, if we were redoing our kitchen, you wouldn't take the first contractor out of the yellow pages and, plunk them down and let them gut your kitchen for you, right? It's the same thing with healthcare professionals. We can interview them and see if they're right for them. So we go through all the steps that you can go through to research and find a healthcare professional that's right for you.
Wow, that's and where do we go? We're to the United States.
UnitedStatesOfHealthcare.com, and just go to our resources page, and it's the first resource there. You can grab onto that, and there's some links then to a blog post that goes into some detail about how to go about choosing a new doctor or a new healthcare professional.
I love it. I love it. Franz, what else? Is there anything else you want to add?
I think that I would again just reiterate, make sure you're continuing to keep track of yourself on a regular basis, get the mammograms, support, of course, Susan G. Komen, and, whatever it is that your heart leads you to. Honestly, there's lots of great things to support. The Springfree team will be out there this Saturday. So if you come out to the walk, we might just see you, and, just keep taking care of yourself and be vigilant. That's the most important thing, I would say.
Thank you. That's so great advice. And I just want to comment, behind both of you are such wonderful paintings. I love them. They're just fantastic. And I think, just summing everything up, we want to, Cinderella CEO, we want to be advocates for everybody who is going through a transformation, who wants to transform their situation, who feels like they may have barriers that they need to overcome. We have been doing this now, gosh, the book that I wrote, From Cinderella to CEO with Anita Bell, we wrote 15 years ago. And since that time, we've built a community of women who, mainly women, but also some men who, great men, who have really helped each other get through the tough times and have overcome barriers to become very, very successful. So we are offering Friday, this coming Friday, the beginning of a course, a mindfulness course. If you go to cinderellaceo.com and go to the mindfulness course, you can register there. And if you mention this podcast, there will be a special rate for you that will, because it's October, you'll get 10% off 10th month, get it? So just mention that you saw this podcast, and we will actually run this podcast again on Facebook with the link. It'll be on YouTube, and then it'll be on any place that you find your podcast, Spreaker, Spotify, all sorts of great places. So I just want to thank my guests, Joyce Griggs and France Jacot. Your in France, am I pronouncing your name correctly? I just want to make sure I'm pronouncing.
Yeah, you're doing great. Yeah.
I need some pronunciation, better French pronunciation, but I did get it better than I did.
Yeah, no, you're doing great.
Okay.
Great.
Well, thank you both. And without further ado, if there's nothing else you want to add, and I'm sure if people want to contact you, they know how to find you. And they'll see you at the walk, Franz, on Saturday for the Susan G. Komen Foundation. Where is the walk?
Absolutely. And it's North Park Mall.
North Park Mall. Okay.
75 and Northwest Highway there. So but the other thing I'll just say, if there's anyone who's listening, who is about to, go through some treatment as it relates to breast cancer, my door's open. My LinkedIn is, up there. I absolutely enjoy speaking to people and sort of guiding them through, because I had that experience. So, and it was very helpful. So I just throw that there. My door is open, so to speak. My LinkedIn is right out there. So just feel free.
That is a very special offer, and I'm sure you'll get people contacting you. And thank you again. Thank you both.
Thank you for having me. This was really nice.
I enjoyed it. I wish we could do it every week. All right.
Yeah.
Great
I know.
conversation.
Take care.
Okay, bye-bye.
Bye-bye.